Welcome back to another episode of the Empowered Plates, Empowered Lives podcast. It's your healthy habits and lifestyle coach, Joe Bonnie, and I help those with endometriosis and polycystic ovary syndrome reduce chronic pain, eliminate stress, and minimize irregular or heavy periods. Y'all, thanks for coming to vibe with me. Today, I have a special guest, Miss Natasha, a physical therapist and a certified fitness trainer, y'all, and she has a personal and a professional story that is going to empower you. Before we get too much into this episode, y'all already know what time it is. And if it's your first time listening to the podcast, welcome. But it's time to vibe with me, y'all. Welcome to the Empowered Plates, Empowered Lives podcast. Yeah, Natasha! Welcome to the studio. How you feeling today?
So excited. I'm feeling great. Happy to be here. Thank you.
Man, I'm grateful for your presence here today. So go ahead and introduce yourself and let the people know all about you.
Yeah, so my name's Natasha Taylor, Natasha B. Taylor, maiden name is Bachier. I am the owner and founder of Black Star Physical Therapy and Wellness, where it's an online fitness coaching community for women. I like to talk about my women over 30, 40 years old. We're going to stay strong. We're going to stay healthy. We're going to prioritize our health. But yes, as Empower Place has just said, I am a physical therapist. I'm a certified fitness trainer, group fitness instructor. I am certified in TRX as well. So I kind of combine my two worlds, my physical therapy world and my fitness world, and I create this coaching platform. I'm also an orthopedic specialist physical therapist for the University of Michigan. So that is what I do majority of my time, in addition to Black Star PT and Wellness. So thanks for having me again.
I am grateful for you. So before we get all into your professional background, I want to dive straight into your journey of strength. What has been your biggest surprise when it came to your own personal health journey?
Yeah, so as we spoke earlier, I've always been involved with fitness. I've always been athletic. I come from a West African background, so from Ghana specifically, where definitely growing up, not by any particular formula, we ate pretty good because we ate a lot of the traditional foods. My parents didn't really give us a lot of like junk food per se or like sugary sweets. We would have it, but we would have it in these little bits and pieces. So that's just how I grew up. Fast forward, I go to college, I do my own thing, but I'm still okay. But now I'm starting to feel kind of weird, but I don't know why. I remember going and they're like, "Are you tired?" And I'm like, I've got exams, I've got this, I've got that. They're like, "Well, your iron is like really low." I'm like, "Oh, okay. It's been low before, like whatever." So they put me on supplements. I do my thing. I keep it moving. I have children later on in life. So this would be where my strength that I didn't know I had showed up, right? Because this whole time I'm like, oh, whatever. I have kids later on. So I had my first son at 37, second son at 39. Within that period, I started losing my hair. And I didn't recognize it at first. I thought it was just hair breakage or postpartum breakage or whatever. A lot of things got just kind of dismissed. I had a really good friend who actually pointed something out and was like, "You probably should go talk to somebody." So I did. And like everyone else, I went the traditional route. I went to a dermatologist. She did what she did, diagnosed it, and gave me a lot of these medicines and topicals that I just didn't feel comfortable doing because I had small children. Either I was pregnant. So during this time, I was either pregnant or breastfeeding. And I was in denial, I'll be honest with you. I just was like, I don't know about any of it. Whatever. Let's just cover it up with whatever hair piece I need to put in. And then I would say maybe the second born, who is now 6.5, was probably like 18 months, 2 years old. And I finally was like, there's something else. There's something wrong. Like something inside of me is telling me something's wrong. So I sought out integrative medicine. And I was like, I don't really know. I know some about it, but I don't know a lot about it. Yes.
You went to the dermatologist.
I did.
And they diagnosed you with what? You said you got
Oh,
diagnosed.
right. I got diagnosed with I'm not great at saying the name. So it's a type of alopecia called CCCA.
Okay.
Centrifugal citrical
Okay. So a
something.
form of alopecia.
It's a
Gotcha.
form of alopecia. It
Okay.
is a common form.
Okay.
It shows in African American women with our hairstyles types. So it wasn't just the traction. So at the time, it was like the traction alopecia because I was wearing weaves and braids for who knows how long. So I had a little bit of that on the edges and the back, but then the top is where it started. It was like the middle, a small patch. And so it was called CCCA. So anybody can look that up and you'll get the full
Right.
term.
And do you think it happens during a certain period of time?
Yeah. So from what I read about it and from what I was taught was it's that later 30s, early 40s,
Okay.
life is changing. And for me personally, because it went from like, you're good, that I thought, to what is happening, right? So everybody comes up with their ideas. You're stressed out, or your hormones are out of whack because you had a baby. Oh, it's the way you eat. I'm like, have y'all seen the way I eat? Like, it couldn't have been the way I eat. I cheated, yes, because I was pregnant. I didn't care. Whatever, I'm gonna eat what I want. But for 30 something years prior to, I did it. Like, I ate really well. So I'm like, there's no way 10 months of me indulging every now and then did this. Come on. And then I went back to the way I ate. Like, it wasn't like I just was like, oh, I'm just now going to only eat pizza. Like, that's not what I did. So that's how we got there. So I had a diagnosis
Okay.
of CCCA, and then just being who I am, I went and researched it myself. And so that's where I found out, okay, this is for the middle-aged African-American women. This is more prevalent in us anyways. Made sense. My dermatologist is African-American. I did that on purpose because I needed to understand the products, the hair texture, all of the things, like just life, right? So she was really good at explaining that. But at the same time, she's a physician. So she was giving me either topicals, or the other option was like a steroid injection to calm everything down. But I was breastfeeding. So I was very much like, yeah, no, we're not doing those things. So then I had to deal with, okay, what's going on here? I don't know what to do. I don't want to do what they're recommending, but I feel inside of me something isn't right. So that's when I sought out like this alternative way, integrative medicine. And that's where I was introduced to that whole area and field and kind of was put on a different path.
How was your experience even finding someone in integrative health? And when you found that person in integrative health, was it something that your insurance took, or was it something that you had to come out of pocket?
So I think when I started, I put in like holistic health or holistic doctor, and then the word integrative would pop up, or functional medicine. So there's a lot of different terms. It just depends on who's doing it and what they're certified or licensed in. So I was seeing integrative medicine. I was seeing functional medicine, functional. So then I'm like, okay. And then I wasn't like 100% like, let's do this. So I kept reading, kind of looked into what that is. Then I made an appointment. So I just went to Google, like everywhere else, what's local, and no insurance. So I'm in the state of Michigan. So whoever's watching, I do have really great insurance, but they don't cover that. So what I did was I have an FSA, sorry, through work, but it was an out-of-pocket fee, regardless. I mean, they don't take insurance. If you're ever interested in any of that, there's blood work, there's lab work that is involved. So some of that was covered by insurance because it was coming from a health provider. This wasn't just anybody doing this. So some of those labs were covered, but when it came to speaking with a provider, and in my case, I had a naturopathic doctor, speaking with her and doing my consults with her and meeting with her on the plan we ended up on, supplements and all that. That was all on out of pocket. So it's definitely going to be a cost, but personally, I had to do something I don't even call it an investment because I don't feel like I was like putting it away. No, I was saving my hair. Like I was taking care of my health. So to me, I was like, whatever it is, I work, I do stuff, I can do this. Like you can do things, you know. And I think, and so now I'm going into my PT self, my healthcare self, and I work in a system. So I feel like, yes, insurance pays for certain things, but we shouldn't shy away from things because insurance doesn't pay. If you physically can't pay, that's a whole different thing. If you can't afford it, if you don't have access to it, that's one thing. And so this is going to be that area, right? Where it's great probably for the majority of our population. But is it accessible financially for everybody? It isn't, you know. So then having podcasts like this, having information, just understanding like there is other ways to manage your health, you know, is the case. But really understanding like if the only reason why you're not doing something is because insurance doesn't pay for it, then you know you could be potentially harming yourself.
I'm glad that you brought that into the conversation. I really want to talk to you about the labs because I'm glad that some of the labs were covered by insurance. If, like you said, you even have the insurance component, so it's less out of pocket for you. I want you to break down the lab experience and were those labs something that you think that your African American dermatologist would have provided you to get further insight in regards to what was going on inside of your body versus just trying to give you that steroid injection. So I want to get into that, but I am so grateful that you took the time to expound upon the fact that holistic, integrative, naturopathic medicine would be hugely beneficial for our demographic to really getting down to the root cause of what is going on with our body. So I wanted to definitely tell you on that before you expound upon the lab aspect.
Yeah. So regarding like our community in general, so we're at a higher disposition or disproportionate rate for a lot of chronic disease. And we, you know, especially over the last few years, we definitely are speaking more about it, what that looks like. Why is that the case? At the end of the day, hopefully you're okay with where I'm about to go. It's so much
Let's go. It's a journey.
I'm educating now. So they're called social determinants of health. Okay, that's an aspect of it's in the public health world, but now medicine is like we need to actually embrace this and recognize that this is real. So the social determinants of health pretty much go down into what other factors affect an individual's health. When the person has hypertension, do you see them as one person with hypertension, high blood pressure, or do you recognize, okay, what else is happening? What type of lifestyle did they grow up in as a child or now that may be creating stressors? What access to food did they have? Definitely as they grew up in life. Did they have grocery stores in their neighborhood? Did they have access to farmers markets? And even if it wasn't a farmers market, a quality grocery store where you can buy produce and quality meat, not like a save a lot, literally. Like that is not a quality grocery store. What do you have access to? Do you have a sidewalk that you can go for a walk? Do you have access to transportation so you can get to the doctor if you do have a doctor? You know, little education. So these are the social determinants of health. So when you look at the entire picture, the entire package, then you can see, okay, this is potentially why. So unfortunately, in this country, African American people in that group have lower area in some areas, not everybody, obviously, but there are some that those social determinants of health really affect their health. And when it comes to chronic disease, why you see the high prevalence of this, higher rates of that, and everybody's like, oh my God, this is horrible. We have to really understand how we got there. It's not just because you're Black, you get hypertension. That's not how this is. It's not what that is. Like I said, I grew up in a Ghanaian household. We ate traditional foods. I was fine until I decided to go out and buy Kentucky Fried Chicken. You know what I'm saying? So that's where that comes from. Pertaining to the labs, my physician did order labs. However, she ordered like a standard panel, which would like check my iron, my blood levels, red blood cells, white blood cells, thyroid, because they're like, okay, is there something going on with your thyroid? Is that why, something's off? Hormone? I think maybe hormone. But it was like a traditional panel that your primary care might also order when they're looking at your blood. Like, let's just check your cholesterol. Let's see what's going on. When I got to integrative medicine, what I learned, even as a therapist, because I didn't know, there's a lot more you can look for in blood, depending on what it is you're looking for. So then I remember, again, I do remember having to, like, I went to like a private, like a Quest type lab, where they could do labs. And my naturopath wrote the requisition, so she was able to do that. So I took it somewhere, and they pulled out like 21 vials. They had like so many vials, and I was like, "What is happening?" And she's like, "Oh yeah, these doctors. That's how they look at a lot of blood." I'm like, "Okay." So then when I went back for my results, she showed me the labs, and she's like, traditional medicine will give you this. They're looking at this window. They need to know, is there something wrong with you? Like now, like, do you have a disease? Literally. I'm looking at this. Let me do this because you can't see my screen, right? But I'll just do this. I'm looking at this. And so therefore, I'm going to throw a number out. I'm not saying that's what it is. Well, let's say they do a 8-point panel, my dermatology. Integrative medicine is doing a 21 panel. And so when they did that and she opened it up, she was like, ding, 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 this is what's going on. And so it was outside, it would have been outside of this. This is going to say you have diabetes, you have cancer, sadly, you have hemophilia, like you have some anemia. So I did have anemia. Oh, you're on the border of being anemic. You're right there. Okay. Your thyroid is fine. You're okay. You're okay. Okay. I'm fine. Let me go home. She's like, no. This one here. So it was my inflammatory marker, the number that shows how much internal inflammation I had or I was in. And the number was high. She's like, this is where we need to focus.
What do you think? I'm grateful that you're sharing this information because I'm learning too. So I hope they're learning as well. When you say the inflame marker was high, are you on a typical anti-inflammatory type lifestyle, or at the time were you eating a lot of inflamed foods? Was it your stress? How do you feel that
why that number was high?
Yeah.
I think it was a combination of things. I definitely think, I know stress was a factor. So at that time when this was happening, I had my second son. So I was working full time, like 40 hours. I'm in healthcare. It's always stressful. That's just kind of how we live, unfortunately. I'm managing, like I have 2 small children. I do have a husband, but I do a lot of stuff. So it's managing all the things. I wasn't exercising like I do now. I would try, but I would be exhausted all the time. So I wouldn't feel like I could do what I wanted to do. So that I would do it sparingly. I wasn't consistent at all. And what I mean, I wasn't consistent. Like the people who know me are like, that's a lie. Like you can do, no, I really wasn't doing anything. I might do something once a week, every 2 weeks, and then feel exhausted, go for a walk. But I was like begrudgingly going. I was more than likely eating. So I was eating inflammatory foods during pregnancy.
Gotcha.
I did cut out some like dairy when I had my son because I could tell he was intolerant. So I cut that out, but I would still eat, not all the time, but I was still eating foods that I typically wasn't eating in the past. So like the more fried, the convenient foods, because I was exhausted all the time. I was just tired and I was working so much. So I was like, whatever, man, let's just do whatever's fast. So definitely I feel like that was a factor. And I remember being overly overwhelmed. I was stressed out. Like I remember feeling like I couldn't handle everything. Because I remember, even before, I don't think I told you this. I think I reached out to like my workplace wellness, like the mental health person, and then this is pretty like, oh, this is good. This is me like, I'm just so busy. I went up there complaining, and I was wearing like I knew I had alopecia, so I was wearing like a wig, and then I just like said something small, and she looked at me and she's like, "You're hiding." I'm like, "What?" I go, "What?" And she's like, "So this whole time, all I hear is that you're micromanaging yourself and you're
Mhm.
beating yourself up for not getting work done or doing this and doing that, and you're hiding your alopecia." And I'm like, "What do you want me to do? Walk around no hair?" Like I was just like, "What are you talking about, lady?" Because I had a piece in, and she was Caucasian, and I felt the way she said it. I'm like, "You don't even understand like my style." I can't walk around. So
Not you don't understand my
you
style.
don't understand. And I was kind of like, "I can't walk around like that." And she's like, "Okay, but you're hiding." And I was like, and so I didn't like her for real. But when she said that, like something clicked, like for real, something clicked. So I went home and I was like I said, I didn't like her, but she said that until now. I remember, I'll never forget that statement. And then probably a few months later, I cut my hair off because I was
And
like,
then when you cut it off, you just embraced it?
I was free. I was good. Like
Yes. Come
I was
on.
okay because by then I think I was. Did I? I'm trying to think. Yeah, I was still when I yes. So when I was with integrative medicine, I was still kind of going back and forth with covering it, like whether it was a wig or some kind of piece. And then so I was doing the work in the sense of the the food I had to change, but I still wasn't okay with what was going on. And then it was later on that year I cut my hair off and I was like, I'm good. Like I'm okay.
I love that. So it
Yeah.
sounds like the inflame marker was high on your labs. Um, you're realizing what foods you're consuming that contribute to that, but you're also saying, you know what? Stress is prevalent right now.
Oh yeah.
And someone's calling you out about it because they're sensing it about you and around you.
Mhm.
And then you go into this moment of, well, let me address that. Let me free myself. How do you how do you believe that what do you believe in regards to stress playing a role in someone's well-being? And then how did you go through the process of getting day to day being more mindful of managing your stress?
So stress is a large factor. So I know we went through my little bio. I'm also lifestyle medicine, health coach, practitioner. So I did a certificate course in lifestyle medicine. And so what lifestyle medicine is these 6 pillars. Again, what is all the factors that affect our health? And so one of these pillars is stress management. So stress in itself can affect your cellular health, like how our body responds. So there's a level of stress we're all at. But when we're at this, let's say, fight or flight, like constantly ready to go, our body can't heal. So we talk about the gut. So digestion is rest and relaxation. That's when our body is desensitized, when our nervous system is calm and chill, when we do our breathing, we are desensitizing the system. And then our gut can do its job. It can do what it's supposed to do, which is where our immune system is. When we are in a constant state of stress, we're overwhelmed, we're anxious, we're depressed, we're worried, like all that, I'm busy, just being busy. Our body can't rest, which means the gut can't do what it needs to do. So it just plays on this cycle, and that's from that end. But from a cellular level, it leads to heart issues, heart diseases. Think about somebody having a heart attack. Usually, when you hear about someone having a heart attack, you'll find out they were doing something either physical or they've been like kind of in a rat race of working, and then they collapse. Because the body can't rest when it's in a high state of stress, and so we call that fight or flight. Like you're ready for a bear at all times, but the bear's not actually there. You're just perceiving that there's a bear lurking, about to attack you. So if you live in there, how do you go to sleep? Like you're not going to sleep well. So stress is a huge factor. And then in my case, again, if I'm sitting in a high level of stress, I don't get to rest and relax. At this time, I'm not putting all the pieces together because I didn't understand this. My gut can't do what it's supposed to do. My immune system is all over because my inflammatory markers are saying there's a huge problem inside of you. So my immune system isn't doing its job because I'm not allowing it to. I can't rest. I can't relax. And so in my situation, it attacked my hair versus something else. Like other people, it's their heart. Other people, it's pain. Like, so I do a lot of chronic pain. So being in stress, high stress, irritate, it's a trigger for all of those things. So if somebody who lives in chronic pain and they can't get out of chronic pain, you recognize, okay, you also can't rest or relax. It affects all those factors. And then what I did personally was I had to be okay with what that woman said. I had to be okay with her saying, you micromanage yourself. I was trying to blame other things. Like I had the answer for why I was feeling the way I was feeling. It was work. My husband's not helping me. My kids are young. I work a lot. Whatever I was bringing up on the table. At the end of it, she said, yeah, you micromanage yourself. It had nothing to do with nobody else. And then the whole avoidance thing. So then eventually I sought out, it probably took from then another 6 months to a year. But I did seek out the help of a mental health therapist, and we would do virtual sessions. And by then, like I tried my best to kind of do little things. So now I'm at the point where I don't have a therapist. I probably had her for like a few months. Um, but she would give me strategies on, like, when people ask me questions, like I would always say I'm okay. And I didn't realize I was doing that. How are you today? I'm okay. Every time, I'm okay. And so the one day she starts laughing at me, and I was like, she's like, do you know you do that? Are you okay? You keep telling everybody you're okay. Are you actually okay? Or do you just say that? That's just your quick response. Like, get away from me. I'm okay. Like, so she made me recognize some of the stuff I was doing to kind of push things away. And then gave me tools, journaling. Like, she taught me a lot of stuff, like the journaling and then I'm part of a mom's group, so affirmations, and it took time. None of this was fast. And I know on social media we act like, oh, you just say this thing and you're okay. No, this was over time where I had to be okay with writing down an affirmation, saying it, and actually believing what I said. You know, so I don't have a therapist right now, like I said, but I practice this stuff. I get up early and I pray, or if I'm stretching, I breathe. I do a lot of deep breathing stuff because I know this is a constant thing. I can't just say because I did it a year or two ago, I'm okay. No, this is a constant practice, I would say.
I appreciate you walking us through that journey. I do. And you got it right at the end, because I was like, tell us, what are some of those things that
Oh.
you needed to do that kind of allowed you to release yourself from the therapist to really embracing life, because now you're doing things that help reduce stress, and that you're mindful and aware of stress management every single day. So the journaling, the affirmations, the breathing through your stretching, that was beautiful. Natasha, that was beautiful. And I appreciate that. But what I'm really am grateful for, that you broke down what stress can do to your body. Like,
Oh.
it's not just cause your blood pressure to go high. That's normally what people say, oh, they got me stressed out, my pressure high.
Right.
No, it was to the point where your body wasn't even functioning anymore. You work out every single day. You eat pretty much clean every single day, except for when you were pregnant, because you felt like you deserved to eat whatever your womb was telling you could eat.
Exactly.
But it was them saying, like, your gut is not allowing you to absorb the iron that you were even you're taking
Exactly. I was
supplements for.
supplementing, yeah.
Your all of the greens, your spinach, your kale, everything you're putting in that is iron rich, your body can't even absorb because your gut is off. And had you not gone to that naturopathic, holistic, integrative healthcare provider that gave you a bigger lab panel to see what was really happening with your body, you would have still been stuck doing all of the spinach things, wondering why your iron is so low, why you're anemic, why your hair is not,
Right.
growing the way you believe it should be growing, because you're doing all of the things to nourish your body in order to flourish. And so I'm grateful you broke that down, but I'm also glad that you expanded on the labs and how we got to that. The stress can't allow your gut to function, can't allow your immune system to be activated. That's a problem.
Yeah.
And so I appreciate that breakdown and that sharing of the story, and then telling us the things that you were able to do. So you go through this. She tells you about what's happening in your gut. What's happening now with your hair? How do we get to the point where we're getting a good regimen so that your hair can grow back?
So that's what we're still working on. I have
Okay.
to be honest. So I was with that program a good 6 to 8 months. But again, because it was a lot more nutrition and habit based, I created those habits. And so I stuck with it for a good amount of time. Now, the provider I had would allow certain foods. Like I had a thing that told me what I was more sensitive to. So I kind of had an idea of what to do. So like everything else, I mean, I did it for a while and then I would like, oh, it's okay if I have a little bit of this or a little bit of that. And again, I do eat relatively clean. But so when I say a little bit of this, a little bit of that, I'm talking like a sandwich with bread because I'm not supposed to have gluten. You know what I mean? I'm supposed to keep the gluten down. But I want a pita, like literally, I just want pita and hummus. I'm in Michigan, they have great Middle Eastern food, like amazing. So it's like, I really want your bread. So when I say I'm a little bit of this, I'm not talking fried chicken. I leave that alone. But I'm talking like bread and hummus. Like people would be like, "Oh yeah, that's healthy, right?" I'm talking. What else would I eat? Cheese. I don't eat a lot of cheese, but every now and then it'd be like, I want a veggie pizza, and I don't like some of the vegan cheese. I just can't tolerate. So I was like, it'll be okay. I'm having a veggie pizza, stuff like that. So I would do those things, but I think the real kicker, um, maybe about 2 years ago. So now we're getting into personal stuff. So hopefully everybody's okay. I started having really heavier menstrual cycles, like heavier than normal. I was like, what is going on? But now I'm 42, 43. I was like, oh Lord, is this it? Like, is this what's happening? And so, I work with a lot of women, so I would say stuff, and they're like, "Oh yeah, it could be perimenopausal. You could be this. You could be that." I was like, "Okay." So I went back to physicians. So in this time frame, I've never stopped dermatology. Um, I would go get my checks because they would be measuring. So my hair did grow a good amount. My patches would do this up and down thing. So I'd have it where it'd be filled in. You couldn't barely see, and then I'd have periods of the year where it would be more prevalent. Then I was like, okay, it seems to be related to seasons. I've always had a thing in the winter where I'm drier, so I was like, well, maybe I need more moisture in the winter. So we were always trying to put together the pieces. What is this pattern? Like, because it would come and it would do this back and forth. So that's why I was like, I think I'm okay. I'm eating this way. I'm trying to manage my stress. So I did not feel as overwhelmed. I would do some of the topicals. So I did do a combination of the food plus the medicinal stuff. I was like from the physician side. So I was doing a combination of the two at that time. And my hair was doing what it's supposed to do. But I didn't like the goal was always to get off of we call them tar, this mixture. That was always the goal. So at some point I started letting slowly releasing some of that stuff. But then like with this bleeding, I went to the physician. They're like, well, you have a history of fibroids. They haven't apparently been bothering you. Last time we checked, they were kind of small. Let's just check because you have a history. So we go, and I had one. So I have a history of fibroid. I had one.
And when did
So
you find that fibroid? Like, when did that show
the
up in your
first
life?
one, the first time I was told, I
Mhm.
was would have been I had a pregnancy loss before my first child, and so when they
Mhm.
were looking, they saw it.
Okay.
unfortunately. So they saw it, and I was like, I had no idea, and it was pretty large. So then the question was, did that have something to do with it? Whatever. So interestingly enough, because of that, my doctor was like, "There's nothing you can do about it." I don't like that as an answer, so I don't like that. Yeah, I swear. Yeah, she got
That
fired.
is so ironic. Natasha, Brianna, podcast episode just dropped. So the one right before this episode, she just said, like, she didn't like that. That's what they always say. Oh, you're African American. Y'all are prevalent of getting fibroids. There's really nothing you can do. Like, there, like, let's just talk that real quick. Because you just said I didn't like that. Brianna didn't like it either. Why do you think, because you're a healthcare professional, why do you think that they think it's okay to say those things? And why do you believe that they feel as though there's nothing you can do just because you have fibroids?
So I think there's a few factors. From the medicinal standpoint, there is nothing they can do. There's no medicine they can give you to shrink it. The only thing they do from a doctor side, it would be invasive. So you remove it if it is to the point where it's affecting you. Let's say in my case, if it was affecting the uterus from holding a baby, and again, it would have been my choice. It didn't mean I had to. If they thought maybe that had to do with fertility, or it was maybe pushing on an artery and causing other issues, they go in and literally remove it at surgery. There's no pill they can give you, right? That's what I feel. That's my personal take on that. I'm just shifting because I don't like where I'm at. I feel like there we go. I feel like somehow I moved to the side. So I think that's their personal take. With everything medicine, the role of nutrition, lifestyle, and this was probably closer to 10 years ago. That is never an option unless it's like you're at a risk of a stroke or a heart attack, so we need you to cut the fat or something like that. You know what I mean? We need you to do like the main basic things so you don't have a heart attack or a stroke, or you're diabetic, so you're supposed to do this. But even some of those situations, I have patients who tell me they were never taught about nutrition. They have diabetes. They're just given their medicine and sent home. So that's what I feel about that. I don't believe that the only thing you can do is take a pill or do surgery. That's, again, my personal beliefs and what I do as a physical therapist, because I treat pain without medicine. Like, people come to me who are in pain. Some are like, I'm on something and I want to get off. Others are not on anything at all. They just want to get out of pain, and their pain resolves through movement, through whatever I'm teaching them. Now I start to add the nutrition, but even before, I didn't know that part. Even just doing that was relieving their pain. So I've always been like, everything isn't in a pill form. So then I went ahead and did my own research, and then found a fibroid cleanse or something. And it was a lot of herbs. But honestly, what it was a lot of herbs and it was a vegan cleanse. It was only like 21 days or 30 days. But that's what it was. And this was like 10 years ago. So I did it. I felt better. I think they measured it later. It shrunk a little bit. So it didn't go away, but it did shrink. I was like, what? Okay. So then it started triggering, like, okay, there's obviously something. But again, it didn't go away, but it's not big. And then I got pregnant a few months later. So like, I was scheduled for surgery because I was like, I will do whatever. I'm in my late 30s. I was scheduled for surgery. She's like, we can't do surgery because you're pregnant. I was like, what? This is a whole different story. This was not on the agenda. I'm sorry.
No, you're okay. It's your journey. I'm loving it though, because we're really touching on this thing with fibroids, and you really just gave people some options even to explore, just to shrink it. So
shrink it. Yeah, it didn't go away, but it shrunk. Yeah. So then fast forward, they go and check because they're like, okay, well, this is on your list. I'm like, yeah. So then they're like, oh, you have 2 small ones. I said, okay. doing my life. So I keep doing it. I was doing well. Now I'm back to working out on a regular basis, um, eating better, doing things. But life is life. So I'm mid 40s. I'm going into my mid 40s at the time, and hormones are doing what hormones do. Like I can't, that part you can't stop. Like I had a question today. Someone's like, "Does arthritis go away?" I go, "No, because we're all getting older. That is part of life. It's how we manage it. Can't stop the hormones." So
That part. It's
yeah,
how you manage it.
it's just how you
It's
manage
not
it.
about making sure you have a clean bill of health with
Right.
no dis-ease or
Mhm.
situations. It's how you manage it. That was,
Yeah.
I didn't want you to speed too fast over that. That
No.
was powerful. It's how you manage it. When you are embracing lifestyle changes,
Mhm.
it's because you're focused on how you're managing what is going on with your body and what you hope to not happen with your body, making sure you reduce those opportunities. So I love that you said that just now.
Yeah. Well, thank you. That was awesome. I mean, even your breakdown was actually pretty sweet.
So these fibroids, now you got two, they're small. What are we going to do? Were they always just two? What happens now on this fibroid journey?
Yeah, so I basically just they were small and at that point, and then I just started having more issues with bleeding pretty much.
Mhm.
And then I went to my follow-up, my primary care. And then by now I'm like all my providers, like my one left, but all my providers are African American women. I'm like, I'll take you. So, and then even the one I found as a primary care, she did the lifestyle medicine. So the lifestyle medicine is like is not integrative, but it's that still mindset, but for the medical world. So they do our understanding, like, yeah, there's other factors. So when we talked and I explained, I'm like, yeah, I'm exhausted, like I'm wiped out. But I went back to well, I have this and I'm doing this and I'm running this. I go, but I'm so tired. I go, and I eat well. Like, I'll never forget it. I do the greens. I'm eating well. I go, I know I have issues with anemia, but I'm eating like all the things. And she's like, yeah, but if you're bleeding out, it doesn't matter. Like, it doesn't matter if it's leaving you. And I'm like, yeah. So she's like, go back to gynecology. So then I go back to my provider and she gave me my options. So I ended up doing what's called a uterine ablation to calm the bleeding because it was too much. So that all it did was address the bleeding, the heavy bleeding. But then now we're back to now pretty much this is in the last few months. Um, I was like, okay, something's up with my hair again. Like I'm noticing the patches are there, but now they're not doing this up and down. They're kind of just hanging around. I think I'm breathing enough. I'm breathing. I'm taking my vitamins. But again, we're back to what's up. So then I find power of the internet, literally Instagram. So someone on Instagram who follows me and was doing like my exercise stuff mentioned something about hair. So I just was talking to her about hair. She's like, yeah, I'm into products and stuff, but I do, I love how you keep your hair short and you keep it natural. And there's certain products that would probably do better. And then I'm like, yeah, but I have alopecia. She's like, what? I go, yeah, can't you see? Like, sometimes when I bend over, she's like, I noticed something, but I couldn't really tell. But so then she sent me like trichologists. She's like, have you ever spoken to a trichologist? I'm like, no. She's like, they're the experts in the scalp.
Mm.
So she goes, I follow you. It isn't how you live, you know?
Clearly.
She's like, what else is something's going on? So she gives me names, and then it took me a minute. And finally, I reach out to one, and when I read her website, I was like, oh, I had thought I was gonna get my scalp analyzed. I didn't realize, again, we're all doing this intersection of all the things. So I reach out to her and I told her my story, and she's like, so basically, when you were doing what the integrative medicine doc told you to do, you were okay. Yes. And then you stopped doing it. Kinda. Well, here we are. All these people calling me out. I don't know if I like this. Are you going to call me out too?
I like that you say, well, I don't like them, but I listened to them and I made the changes. So I
Exactly.
like that you're at least, okay, I'm aware now. Don't like the fact that you call me out. Brought
Right.
the awareness to me, but I'll do it.
I guess.
I'll give it a try. I guess I'm worth
Right.
that.
Yep. So that's where we are now. So then that's how I ended up finding she's a trichologist, but with certification in like, I think in her sense, it's functional nutrition. So here we are. I haven't actually started that particular journey, but I'm in the process. Like there's stuff we need to do to prepare. So I'm kind of in that space.
So it's the trichologist, you said?
Trichologist, yeah.
Trichologist. Okay, so is that also what you refer to as a holistic hair coach?
That is my holistic hair coach, yes. But
Okay,
I don't think all trichologists are
are holistic
this.
hair coaches.
She
Okay, so
chose to add it to her practice. Yeah.
gotcha. So in the event that you're unable, and is a trichologist within the medical professional, like you can do
I
that, or is
don't
that another
think
one of
so.
those
So that part, yeah,
integrative?
this is I think it's this would be private. So I think they're in the
Okay,
hair world. I think they're just another form of a hair specialist that is not a dermatologist.
okay, I
Yeah.
love that, and I love that we're getting so many other functional practices and holistic
Mhm.
practices for people who just want to specialize in one particular area to truly help people
Right.
with this, because I had no idea that a holistic hair coach even existed. I had no idea people specialized in that wasn't a dermatologist or
Right.
someone in the medical field in our traditional healthcare system here in the US. So I'm glad you even brought that aspect to the conversation with your fibroids. You were talking about bleeding, heavy bleeding, a lot of bleeding, bleeding for a while. What was it that helped you get your bleeding under control? Or do you not have your bleeding under control just quite yet from your fibroids?
Right. So I did the procedure.
Okay, the
So I had to get that.
myomectomy.
No, I didn't have myomectomy. So myomectomy means they're removing the fibroid or taking it out. I had
Okay,
it's called a uterine ablation. So my fibroids are still there,
okay,
but
gotcha.
they reduced. I don't want to think about what they did, but
We don't have to go that far until
yeah,
you can look up the uterine
you can
ablation.
look
We
it
don't have
up
to get into
yourself.
that because I
But the
definitely
goal
don't
is
want
to
to
reduce bleeding.
triggering to your journey or your experience just to try to figure out what all they
Yeah.
did. I do know people suggest the ablations. What
Mhm.
made you okay with going through with that procedure? Because I've seen some people say no to the ablations. I've seen
Mhm.
some people say I just got to do whatever I got to do because I've been bleeding for so long. My iron is low. I'm having to get blood transfusions. What was your perception to why you went ahead and said, you know what, I'm gonna go with this procedure?
It was your latter statement. It was just too much. I was bleeding too much. I had labs done by my doc, and when I saw my numbers, I was like, "Come on, Tash." Like I've been anemic, and it's interesting. My hair coach was like, "You," like she wrote down her summary. She's like, "Oh, childhood anemia," and I'm like, "Yeah, she's not wrong." Like I've had something. I've always remember having to take iron from probably like let's say a teenager and on. Every now and then I wouldn't feel good. Okay, go take your iron. But the number that I saw that day and how like the graph, everything's so graphic and color coded. It was just so drastic. I was like, well, that makes total sense. And then like I love people just being straight up and real. So even when my PCP was like, you can eat all the greens you want. If it's leaving you, again, she wasn't thinking about the gut. She's just being completely practical. The thing it's leaving. Like so whatever you're taking in is also just going. It's not staying in you, you know. So that's what was my final. I said, as much as I don't want to do this, I'm not having kids anymore. Let me take care of this because I wasn't feeling good. Like I just wasn't feeling good anymore. So I was like, let me just do this. And then now I have this coach, I'm gonna build up, I'll build it all back up because I was like, I could have gone the nutrition route, but this was still happening. So I kind of didn't have it. I personally didn't feel like I had a choice. I had to do something.
I Love that you brought functional nutrition into it as well. Dr. LJ brought that in, the holistic endo expert, and she was talking about an MRT. And you get an MRT, and it tells you kind of similar, and maybe it was what you had with your holistic professional when they ran the labs. It tells you all about the foods that your body receives well and the food your body doesn't receive well. So you could be saying, I'm eating all of the spinach and this and that, but if your body's not really one to really appreciate and get everything it needs, all the nutrients it needs from that spinach, then you're not going to be able to really say that you're not as effective as you think you are. So I love this conversation, even for me being more exposed to functional nutrition. I even went and did a functional certification course, nutrition course, just because I wanted to better understand how food, herbs, water, sea moss, like just how these things truly help heal the body and what they address. So I'm grateful that you even sought out professionals to be able to say, okay, what do I need to do? Because they're giving you a whole different answer than, oh, you just have fibroids. There's nothing I can do about it. Oh, it's just alopecia. I can just give you a steroid shot. Like that didn't work for you. You didn't settle with that. And so I'm grateful that you're here to share that journey with everyone, so they know that they have other options and that they can explore other resources and professionals to get more answers for themselves so they can choose the route that's best for them. So I know we were into your personal journey, which I absolutely love, but you talked about movement and you talked about chronic pain, and you said, I was helping people reduce their chronic pain just from movement. But I also know that sometimes that's not always enough. Why chronic pain, Natasha, with your physical therapist background, and how do you take that mind-body connection approach within your practice?
Yeah. So I would say that in the last, I would say 5 to 10 years, even within the therapy realm, like we were like, okay, chronic pain, what is the correlation with the brain? So there was a group of people that called it pain science, like it's in the brain, like you need to address the brain. But the approach was a little harsh, like just think positive and your pain will go down. So it wasn't always so receptive. But the point of the like addressing the mind and understanding um how our thoughts, how our association with pain affects your pain. So, kind of going back to that fight or flight, if this person is stressed and always worried about pain and afraid to move, well, if I bend over to pick up the sock, my back's going to go out because 3 years ago I bent over and my back went out and I had to go to the hospital. I don't want that to happen again. So, I'm never bending over. That's not a functional way to live. So you're constantly afraid of movement because it's going to cause an injury or pain because it did years ago. Or unfortunately, let's say you were in a car accident. I'm going to use car accident just because that's a little bit more common, and you hurt your back or your neck, and you go through this traumatic, not only actual accident, but now this series of treatments and all this stuff, and you do get better, but what happened at that accident, you can't let it go. So then some days you're okay, but others you just, no, I'm in pain because I was in a car accident. When was your car accident? Well, it was 10 years ago, but I hurt my neck in a car accident. So my neck is bad and I lost my job because during that time I couldn't work because I was in a lot of pain and I couldn't lift and I couldn't tolerate standing as a cashier. So I lost my job and it affected my income. So now you're into so how would that affect anybody, right? You're more than likely going to end up, if you're not sad, I'm not saying depression as a diagnosis, but going into that depressed feeling, I'm no longer good enough to do this. I'm irritable at home. My family doesn't want to talk to me. So now we're in this mix of, and this is all because of my car accident. This is all because I have pain. So it never really goes away. If you're in pain, when people are in pain, we just want to feel better. Everybody wants to feel better. So what do? Even if you're not feeling good, sad, a lot of people eat. What do we eat? We don't eat carrots and kale. We're going to eat ice cream. You know, you have your tub of ice cream and you're just crying or drinking. You know, that substance abuse is high for that reason because they just want to get rid of this pain. All of these are triggers, right? So now we're just keeping that pain high. But the mind is huge because as long as you keep replaying whatever happened in your brain, or the fear of movement is a big one. I can't do that because when I did it, this is what happened, and I can't have that happen again. So I'm not doing it. Or they try to do it and they're so rigid and stiff that it's just really not biomechanically sound. So we're like, no, that's not how, nobody sits like that. That's not how you move. Well, that's how I move because if I do it the other way, I could hurt my back, I could hurt myself. So that's where I incorporate both in the clinic and in what I do. And I try to just educate people like, number one, movement, any type of movement. Again, we don't need to be lifting crazy weights because somebody told you need to. You don't need to ride the Peloton super fast. I don't need you to go for a run when you don't run. Yes, you probably won't feel good. But can you go for a walk? Can you dance for a little bit in your kitchen? Can you go play with your kids? Can you garden? Like just moving your body and getting your body going into the positions and motions it was designed to do is healing.
I love it. And I'm grateful for you to even have that approach as a physical therapist to help people navigate through that mental and emotional state that comes along with being in the physical state of pain. Like, I don't believe everybody takes that approach. And that's what makes you, Black Star PT, a whole different vibe than any traditional, physical therapist. Something you said within that breakdown that really stood out to me was being in chronic pain. You're clearly listening to people in pain. A lot of people with endometriosis, fibroids, PCOS, polycystic ovarian syndrome, they're in debilitating pain. And not everybody is listening and mindful of that pain. What strategies, what support, what insight would you give people who are trying to navigate that healthcare system to get people to take their pain serious, especially women, and especially how you talk about your target audience of women 30, 35 plus with this chronic pain?
Yeah, and that group of women for sure it falls into chronic pain because you're in pain, pelvic floor pain, pelvic pain, low back pain that feels internal. All of that is all connected. I'm a huge advocate, and I've been doing this without recognizing I was doing it before, and now that I'm a lot more aware, I tell my patients who are like, nobody's listening to me, or you're the first one to ever say this and that. So it's interesting because the medical field is getting better, but there's still this hierarchy of rank where the physician is everything and what they say goes and they write orders. So what I do, if I think there's a test they need, I'll write it on a sticky note and I say, here, next time you go to your doctor, ask about this test. Or the system I'm in now is a little bit more open, so I can send a private message like, I saw so-and-so, this is what they said. Do you think maybe we can look at this? I can't prescribe anything. I'm not allowed to say they need this, and that, but I can recommend. I can say, based on blah, 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 I think it'd be ideal. So I will reach out to people who are afraid to talk to the doctors. There's that. I don't know what to do. I don't know how to reach out. Okay, I'll do it for you. Or they're like, no, I can send them a message, or I don't mind calling. I'll write down what they need. That's how I started, because I was like, I don't think they're even going to accept me saying. At the beginning, I was like, they're not going to accept it from me because I'm a physical therapist. They're going to be like, what do you know? So I just used to write down the tests that you need this test. Have you ever had this test? No. Here you go. This is what you're going to go ask for. When it comes to pain, specifically with women, specifically with Black women, there's a known bias in medicine with that. I will tell my patients that straight up. If we're comfortable and they feel comfortable with me, and if they're part of an ethnic group or a marginalized group, that is known to be biased. I won't say, oh, your provider is biased, but I will say, make sure you tell them. Don't just give them the number. Tell them you have pain when you do, put it towards how it's affecting your life. And then you ask for this. And then you're gonna
like that.
And then you're gonna ask for, if it's a test. Sometimes it's a test. Sometimes it's just, it may not be a procedure per se, but a lot of times it's a test or something, or it's more services. Sometimes it's services. Sometimes it's not that. It could be a service you need.
I love that you're equipping your
about. Have you ever spoken to a dietitian? Nope.
That's the beautiful thing. Not all providers are taking that approach. So not only are you informing them, you're making them aware of the biases, but now you're saying, this is the recommendation I want you to take to them. But on top of that, you're going to bring them personal experiences of when you're experiencing this pain and how it's affecting your life. Not just, I'm in pain, I can barely move, I can barely go to work. Like, you're specifying how this is affecting your life, what it feels like, and this is what I need. So then that way, it's harder for them to just say, well, you're an African American, this is typical for you. There's nothing I can do about it. Yeah. It's so much.
I already prescribed you medicine. I'm not giving you any more. That's
there you go.
That's like, a big one. They'll come back and they're like, they won't give me anything. I go, what do you mean? They gave me 10 days. What am I supposed to do with 10? I'm like, yeah, that's a big one. They won't prescribe medication. You can say you're a 7, 8 out of 10. And they won't prescribe. So this is
the integrative medicine.
No, not in, like traditional medicine, like for pain management. Yeah, so if you've been given so many, like I've had, they'll come back and they're like distraught. They're like, they won't prescribe me anything. And I'm like, so.
I got you. Yeah. So let's talk about, I know we talked a little bit about your own personal journey, but let's talk about consistency and motivation. Like how does staying consistent with health and wellness practices, we clearly know it's tough. Like you even talked about it, like I got to stay away from the gluten, but I want some of that pita and hummus, every now and then. What strategies would you recommend for maintaining motivation and consistency, especially when people are dealing with chronic conditions? Because if we're talking healthy habits and lifestyle changes, we're not talking quick fixes. How do we take this approach? Like how do we stay consistent and motivated?
Yeah, definitely when you're starting out beginner or you're recovering from pain, injury, or managing pain. I'd really say managing chronic pain because it's been there for a while. So we need to learn how to manage. I explain the healthy habits. I really explain like looking at it from the bigger picture and knowing that you're going to have good days and bad days. And just because your pain didn't drop drastically and you were walking and you were breathing and you were drinking your water and you're hanging out with friends. So these are lifestyle medicine. So I'll go real quick. Lifestyle medicine is exercise, daily exercise, 30 minutes of some sort of physical activity. Like I said, it could be gardening, just some type of physical activity. And you don't have to do this every day. Nutrition is being mindful of how you eat. So mindful eating, like what am I putting in my body? The trigger stuff we have to that's just an understanding, so I won't get into that, but just really what am I putting in my body? Is it nourishing me? Positive connections, like social connections. Do you talk to people? Is it a positive situation? So positive connections is a pillar. Stress management, as we talked about earlier. Your hydration and avoiding risky substances. So your alcohols and your smoking and any other drugs. So I tell people, usually people will tell me like what the hardest thing is. And then we'll say, okay, let's just, what one thing can we do to help that? Or in sleep, sorry, I didn't get into sleep, quality sleep. So my recommendation would be to start small. If you're somebody who doesn't exercise, then I need 10 minutes. You can do something for 10 minutes. I'm not going to ask you to do 30 minutes, right? I'm not going to go to the top of the list. Do 10 minutes. Just get used to moving for 10 minutes. And if 10 minutes doesn't hurt you and it doesn't bother you and you want to try 10 minutes later on in the day, try 10 minutes later on in the day. But this first week, I just need you to do something. Walk to the mailbox, come back and do something for 10 minutes. Walk around your house for 10 minutes. And you can break it up if you want to. Just get 10 minutes done. Do that for a week. The next week, we're going to try to add 5 minutes. So we're going in these incremental steps. When it comes to food, again, we're not cutting everything out. The biggest thing is, okay, what of the triggering foods can we start to eliminate? So we're not going to talk about how clean are you eating. If you're a heavy drinker, let's try to wean that, right? If you're somebody who eats out all the time, you get takeout all the time, how many times can we reduce that? Maybe you don't go every day. Let's try twice a week, or whatever it is. Sleep. If you're not getting more than 7 hours, that's your goal, is to get to at least 7 hours, So that's how the approach I would take in that sense. It's like not just only focusing on I'm exercising or I'm eating right or I cut this out, and also not being drastic about it, because that takes discipline. That takes a lot of discipline. And for you to get there, you have to be here. Like, you have to be ready in your brain to say, I can handle an anti-inflammatory diet, because that's not a simple diet. I can handle that, but you have to be prepared for that. So I would say small steps every day. I know that's a thing. So small steps, and just really embracing the small steps and being okay with just waiting and being in that process and embracing the journey, and honestly looking at it as a lifestyle journey, not a challenge. I tell people, I'm like, I mean, there's a few times I do challenges, but I don't like challenges, because a challenge means it's going to end. You're only willing to do the work for 30 days, and then you're like, oh, I finished my challenge, so I'm good. No, it's a lifestyle journey.
It is. And the program I created, it's called the My Healing, My Journey program. And I like to stay away I like challenges in regards to the month, just to be tunnel vision focused. Like, hey, it's Breast Cancer Awareness Month. Let's go 75 miles this month. Like, let's just get to moving, get to stepping, getting to dancing, getting to walking. Like, those I like, because it's accountability approach.
Right.
But when it comes to healing, I love to say it's my healing, it's my journey, because healing never stops. And what I loved about what you articulated so well was, it's not just about the movement. Move 5 minutes, then it go to 10 minutes. Then you don't have to be an expert. You don't have to say, I looked online and they say I need a certain amount of minutes every day to hit this, to lose the weight. Like, be patient with yourself and give yourself grace. The mindful eating, you talked about it. It's start looking at, and I have an anti-inflammatory guide. So good job on that one, Natasha. Y'all, in the link of the description of this podcast episode, is the link tree. Click at the top. It's an anti-inflammatory guide. That is to help you get started. It is talking mindset, which I love to approach with the thoughts, feelings, and beliefs, just what you just said. What am I willing to do? How am I going to do the things that I say I'm going to do to change my lifestyle, to start adopting those healthy habits? Getting in sleep, 7 to 9 hours, knowing how the role sleep plays. You're not going to sleep as well if you're high stress. Talking stress management. Then it goes into eating foods that are anti-inflammatory. Start incorporating some of those foods, some of those herbs and spices that help with, in the inflammation in your body, to help decrease that. And then we got movement, and you just talked about it. Do what you enjoy. If that's gardening, get in the garden and move. If that's walking, walk it out, sis. If it's dancing, get your groove on. But it's supposed to be stuff that you want to embrace, because it's something that you know you deserve, and the type of life that you deserve, to reduce that chronic pain, to start eliminating that stress, so your body can truly function the way it was created to function. You know what I mean? And so you can start finding a way to regulate those heavy periods, or periods that are just painful and they shouldn't even be, or you know what I mean? And so I love that you broke those things down, but you said positive support, positive relationships. Now we're looking at what our relationships look like with people, but also within our environment. And that plays a huge part in your healing as well. So I appreciate you bringing that out and saying, hey, there's a full picture. No one wants you to have a perfect diet. when you don't even know what that perfect diet looks like for you. I am a huge component on when you're changing your lifestyle and when you're embracing foods that are good for you. You said it first. Start with the trigger foods. If I already know processed sugar does me wrong, if I already know dairy does me wrong, if I already know when I eat certain meats, my period experiences are totally different when I'm eating meat, then those are the things I'm going to start taking out and embracing alternatives to, so I can still get that taste, texture, cultural experience and switch it out. You know what I mean? So I'm finding alternatives that I think are good. I'm a foodie. I want good food experiences. You talk
Exactly.
about yourself. If I want the pita and the hummus, I want the pita and the hummus. So let me do it in moderation, not something I get every day. I'm going to say it's a pita and hummus day every week. You know what I mean? You didn't say that. I don't know if that's what you're doing, but I believe it's truly in moderation, because your body does not deserve to consume it on a regular, but your mind is saying, and that's a big part of mindful eating, I have a craving for this. I'm going to address it. I'm going to have one serving of it, and then I'm going to let it go for as long as possible. It's addressing those things. Don't say, oh, well, I'm on an anti-inflammatory lifestyle. Then I eat some cheese and say, oh, I done messed up, so there's no need for me to even go on it. No, that was one opportunity that you chose to consume dairy. You can still be on that anti-inflammatory lifestyle journey, because it's not something that you have to box yourself in. It's what you're doing, each choice that you make to help your body heal and work with you. So that was, man, I love the breakdown, Natasha. I did. And I hope someone caught that, because you see a lot of people already in this lifestyle and you wonder, how did they get there? And you said it's the word discipline. But before you get the discipline, it has to be the mindset. And so it goes to your thoughts, your feelings, and your beliefs. But you have to be aware of what's happening in your body. If there's no self-awareness, there's no way that you could even approach the healing journey the way you should, in order for it to truly be something sustainable and not just a quick fix or a trend because you see it popping off on social media, or for other people that it's work for them. So it's work that you really got to do. But man, this has been an amazing conversation, Natasha, and I really appreciate you for taking the time to go through this. These are my last two questions. So I know you have sons, but you clearly, was a daughter. You're also, I think you said you're married as well, and you have fibroids. So this question is for father figures, male role models, girl dads, partners, and spouses. How can they best support people with irregular or heavy periods, polycystic ovarian syndrome, endometriosis, fibroids, adenomyosis? How can they be a better support system? What are ways that they can be a part of this, not only conversation, but within this journey of support?
I would have to give my own personal take, and I would say, so, like, honestly, just be a support to that woman, whether it is your daughter or your spouse. Just understand, like, that. So I'm like mid-40s. So like I remember growing up, and it was like, when it's time of the month, like, oh, stay away, like, whatever's going on. And maybe that's what you need. But as now a mom and somebody who stays busy, and I think all moms are busy. I don't care if you work in the home or not. Like, there's just so much going on. Maybe during that time when they're trying to heal, specifically, especially when it is their menstruation and it's just they're not okay. You can tell they're not okay. They're exhausted, they're in pain, they may be irritable. Just understanding, like, all they need is really support. So if it's taking the load off. I remember talking to my husband en route to get this procedure. I love him dearly, but sometimes I just have to remind him, because he's so used to me doing so many things, even if I'm exhausted. I said, I can't do it this time. Like, I just need you to handle the boys and manage things that I would normally take care of. And it's probably housework or whatever. I'm not asking you to do every single errand, but some of this stuff that I'm always complaining about, literally, I need you to handle that. So I'm not worried about it, because I know me. For me to heal properly, I need to be okay knowing that if I'm laying in bed, I'm not stressed out and worried about whether or not this, and this is done. I'm not worried about when I come downstairs, the house looks like it was literally turned upside down. So if you can manage those children so that the house isn't turned upside down, my brain will feel better and I can actually rest so I can heal. So I would say taking the load off, whatever that load is, because everybody's load is going to be different. You know, there are a lot of husbands who definitely do childcare and do stuff around the house, but maybe the load is something else. It could be financial. We don't know, right? So that would be my suggestion from the, I guess, from the spouse side, and then from the dad side, learning about it. I would say just understanding what your daughter's going through would probably be good, and not like putting blinders on and pretending like I don't need to know about anything because that's not me and my body doesn't do that. So I don't need to know, especially if you're a girl dad that is involved, you know, and not squeamish. You should really know so that if she's, because again, a lot of us just don't know. Let's just be straight up honest. Like we might just feel like we're just overly tired because that's what it is. But if you really recognize what's going on, that could be anybody. Then if they don't look right, if something doesn't seem right, you know, then you can maybe bring it up like, what's going on? Like maybe we should go back to the doctor. Maybe we should go, you know. So I guess from the dad side, I would say that, like, let's just pay attention and kind of understand what your kid has. So you can be that support. Your support would be like speaking up for them, advocating for them, because teenagers or children, they don't really know. You could be early 20s, you still don't know. It's hard to advocate for yourself in the healthcare space. It really is.
I agree. And I love that you said that. And someone else mentioned that as well. And it's also like, take them with you to the emergency room, you know, so you have somebody that's there, that's witnessing and can advocate and say, this is what's happening. This is what's going on, in addition to the patient advocating for themselves. So it's good to have that role. I know one of my friends was talking about, like, as a child, her father having to take her to the emergency room, carry her into there, you know, period after period, month after month. And I just feel like and because there are some girl dads out there, you know, they just love their daughters. And it's, how do we better get them in that conversation to make sure they're able to advocate on their child's behalf, to better go with, like you said earlier, this is what's happening and this is how it's affecting my child's life with this pain. What else can we do? Or what information is out there to say, I need you to do this because it's affecting my child's life, or it's affecting my spouse's wife. But I also love that approach of just be supportive. There are some things I'm not going to be able to do every single day. I know I might be the rock in the family or the household. I might be holding certain things down. I might not have the strength to articulate to you, this is what I need from you. So be aware, be observant, see what's happening and fill in the gap. Be that good teammate, that good partner to say, hey, I got this. Make me not even have to ask because I'm trying to navigate this myself. So I like that you hit on those two very different components, but I hope that, you know, it was received well for those that this question is all about, because it's really important to me to get other people into the conversation, because I feel like having these conversations, we're not doing enough of it when it comes to women's health or women's health issues, because they feel like, well, I don't got all that, I don't understand. When you don't have to understand all of that, you could just be supportive and you could advocate. So thank you for that.
I would say I'm starting to see a trend, more social media, like when you're having panels and like webinars, men are in the women's health space, whether they're in, like, they are in the space anyways as professionals, but you're starting to see now that they're being invited. And I think part of that is what you're saying, like, how do we educate and how do they know? So we can't really blame them for not helping or not knowing if they just straight up don't know, and vice versa. So I think when we have things and understanding, okay, or like you said, the one that the dad carried the daughter, let's talk to him. Like, what made him, like, not other than she wasn't feeling good, but he must, while that process was going on, he had to learn, why is my daughter going through this every month when other women don't do this, right? So talking,
or I'm not having to take all my other girls
exactly
to the emergency room as
right.
well.
What is this, right? So bringing them in the fold of, okay, this isn't just a foreign area that nobody talks about. and only women talking.
Or there's no place for me in this conversation when there is definitely a place for you. Yeah. I wholeheartedly agree. And then so last question, if you could have a meal with any historical figure, who would that historical figure be and what would you all eat?
Oh my God, that's a great question. I don't know. There's so many. Personally, I think, and this, someone brought something up the other day, and I would say Nelson Mandela. Because talk about strength and perseverance, right? And forgiveness. So going through all that, living that life in your own home, being jailed, all the things, coming out, and then being the people's people because you stood fast to what your beliefs were. Like you never let go and you were willing to lose everything over it. And he did. He lost his freedom, at least family couldn't be with them. But to come out on the other end, was able to live a longer life and, you know, run the country that that did so much to him. And I don't ever, I mean, I'm sure he spoke, but you never heard him, like he spoke down on that practice, but it was never like you did this, and he never used that to interfere with his ultimate goal. Does that make sense? Like, yeah, that could have, I mean, that should have broken anybody, really. So the fact that he used that just as more fuel, like, no, this is I'm doing what I'm supposed to do, and if it means this, and that's fine, but I still got to do what I got to do, and I got to get, people need to be free, and only for them to be free is, you know, sometimes there's sacrifices, but I can't give up, you know, that. So perseverance for sure. And yeah.
So what's on that empowered plate? I love that breakdown, and I love how you gave that empowered life of Nelson Mandela some love and light. I love it. What y'all eating? What y'all eating? What y'all eating?
Are you asking me?
Yeah, what are y'all gonna eat? What would y'all eat? That was the other part of the question. What would y'all eat? What are y'all eating?
Yeah, I want traditional food. I'm gonna have, if we're in South Africa, I want traditional South African food. I don't know what that is. It'll be clean. It'll be veggies. It'll be vegetables. Or because I do know.
Okay, come on now. We getting somewhere.
In Ghana, I'm gonna have. It's called wache. So it's plantain with black eyed peas, and it's cooked in like a tomato stew sauce. It's amazing. So plantain. Like ripe, fresh, organic, literally cut from a tree that was right there in your backyard. So like you can't get more organic than that. Yeah, so the stew is black eyed peas and tomato, onion, garlic. It's like our base. You cook it together, pepper, and then boiled plantain. And then you could have, usually it's paired with like a grilled fish. So if you wanted fish, you could have fish. If you don't, you get your vegan meal, literally. And oil is fresh palm. Like that's how the food is. So that's what we would eat. We would have wache if we're in Ghana. I don't know South African food, but it would be vegetables and something good.
I love it. I love it. All right. So go ahead and let everybody know where they can find you.
Oh, of course. So again, my name is Natasha Taylor. I am Blackstar _ PT Wellness on Instagram, Facebook, and YouTube. On YouTube, I have a YouTube channel called Strong Her Wellness with my name, where I do, there's free videos, a lot of stretching videos, a few strengthening and stretching, strengthening exercise, but mainly stretching and getting that mind-body connection. Otherwise, I have a website, www.blackstartherapy.com. So social media is the best way to find me. So Blackstar _ PT Wellness.
Thank you. Thank you. Thank you. Thank you for coming and being an amazing guest, sharing your journey of strength with fibroids, alopecia, but most importantly, how you are making an impact for women 30, 35 and up with dealing with chronic pain, y'all. It's Natasha Taylor, Blackstar PT. Nah, it's absolutely amazing. Y'all, thank you for tuning in to another episode of the Empowered Plates, Empowered Lives podcast. Click the link in the description of this video and make sure you tap in. Come vibe with me. If you're looking for a healthy habits and lifestyle coach, if you're getting that anti-inflammatory guide because you want to start taking it one step at a time, or you're just looking for a community, all of those links are on that link tree. So click on the link and figure out how you want to vibe with me. Y'all, if you're listening on the podcast distribution platform, make sure you're following the podcast and go ahead and give the podcast a rating. And if you are tuned in on YouTube, make sure you are subscribed to the channel. Hit that notification bell so you never miss an episode or a Nourish and Flourish Vibes mukbang or any video or the clips and highlights from podcasts. Make sure you click the notification bell so you stay in tune, so you stay with the vibes, okay? And you don't miss anything. And then go ahead and like the video that you see right now and tell us what's your big takeaway. What is your big takeaway from this experience? Or if you have an experience with a holistic healthcare provider, tap in and let us know how that went as well. That was a big part of this conversation. But we love you. We thank you. But most importantly, remember, it is your journey, your healing journey. You embrace it. You take what you're able to get from here and go be empowered to be your best, vibrant self because you deserve nothing less. Love and light.